Dr. Yoon Lee is an associate professor of the School of Kinesiology and Health Studies with a cross appointment in the Department of Gender Studies as well. And this is all at Queen's University, Ontario, Canada. Dr. Lee is an affiliate investigator with the Children's Hospital of Eastern Ontario Research Institute and a visiting professor at Yonsei University in South Korea. She's trained in health psychology, behavioral medicine, and epidemiology. Dr. Lee investigates how environmental, social, and behavioral systems interact, shape health outcomes, particularly in the context of urbanization, air pollution, and climate-related risks. Her research with others in the program advances understanding of how people and communities adapt to evolving environmental challenges through behavioral resilience and equity-driven public health strategies. So please welcome Dr. Young Lee, and she is going to do Moving for the Planet, Rethinking Health and Behavior in a Changing Climate.
Thanks,
So,
Shirley, for a nice introduction. Yeah,
yes, we can hear you perfectly. Go ahead.
sounds good. Okay. Yeah, welcome everyone to my talk, and I appreciate the opportunity to deliver a presentation for this group. I am passionate about climate and health research, so this is a perfect platform where I can really connect with other people and share my interest. So in today's presentation, I'll share how my work explores the intersection of climate change, human behavior, and health, focusing on reframing movement not only as an individual activity, but as a planetary health behavior. So, the big picture, we often discuss climate change in terms of temperature rise or extreme weather or wildfires or mental health crisis, the things that we experience in our daily basis. But it's also transforming the very conditions that sustain health. So it's a population health crisis that is ecological, behavioral, and deeply inequitable. And I say deeply inequitable because health risks due to climate change are not evenly distributed, and it's also shaped by geography, income, and other social structural factors. And I try to add a 24-hour movement behavior into that equation when I look at the association between climate change and health. And when I say 24-hour movement behaviors, it includes physical activity, sedentary behavior, and sleep. And these behaviors, they occur within a finite 24-hour period. They're interrelated and they're fundamental to health and well-being. And we also know that these three behaviors jointly influence health and well-being. And we also know that climate change influences where, when, and how people can move and rest safely. And when I say physical activity here, physical activity isn't just exercise, it's part of our daily rhythm. So it includes any movements such as outdoor play, indoor play, active commuting, active transportation, leisure, recreation, and sports participation. And climate change affects that rhythm of daily movement. So that is the underlying assumption that I have in my research when I add 24-hour movement behavior into the equation. But to date, most research focuses on physiological or environmental exposure while neglecting behavioral and social pathways. So it is important to understand how climate change influences behavior, who is most affected, why systemic patterns exist and persist, and what we can do to make our lives better. So in the last point, when I say what we can do to make our lives better, there's a hope and empowerment component that I want to really highlight throughout my presentation. So my research group is In Situ Population Health Research Group. So here In Situ means studying people in their lived environments. And I conduct an interdisciplinary research at the nexus between sociology, epidemiology, and behavioral science based on core principles such as quantitative intersectionality. So I look at the equity perspective, climate and equity integration in my research, and also shifting away from the biomedical emphasis in behavioral science research, but setting behavior as part of the solution. And I try to clarify the pathways between climate change, behavior, and health outcomes by adding behavior into the equation. So this behavioral pathway, it helps explain how climate exposures affect health and also offers intervention points for building resilience. So what can behavior do to buffer the impact of climate change on health outcomes, or how can behavior explain the relationship between climate change and health outcomes? So, in order to understand my research better, it's important to know what mediation and moderation is. So, I added this slide and I'll explain briefly what mediation and moderation is, in case there are someone who don't know these concepts. So mediation, it explains why in the relationship on the causal pathway. So for example, heat reduces physical activity, thereby leading to poorer health. So in this model at the top, physical activity explains the relationship between heat and poor health. And at the bottom, for the bottom diagram, it explains the moderation. So why the relationship between climate change and health exists and how this relationship can be explained. So for example, active individuals can be less affected by heat stress, while less active individuals can be more affected by heat stress. So basically, mediation explains why on a causal pathway, whereas moderation explains how this relationship happens. And also, my research also focuses on going beyond the individual choice narratives, so lifestyle blame, victim blaming narratives, to structural responsibility. So it has an emphasis on structural culpability in climate and health outcomes. And this is because movement is shaped by built environment and urban planning, socioeconomic conditions, policy, ideology, and governance. So movement is not just dictated by individual choice or lifestyle factors. It is dictated by external factors. And this is because behavior occurs within systems that may enable or constrain adaptation. So, based on the core principles and underlying frameworks that shape my research, now I will move on to presenting some of my relevant work that I have done in the past 5 years or so. So, the first one is the freedom to pollute, an ecological analysis of neoliberal capitalist ideology, climate culpability, lifestyle factors, and population health risk in 124 countries. And what triggered this research was based on the WHO's assertion of four major causes of NCD risks. So not anymore. Now they added air pollution and they list a number of causes of NCDs within the socio-ecological modeling. But in 2018, 2019, when I was contemplating about, okay, what is the relationship between physical activity and climate change and health outcomes, they outlined on their webpage that there are four major causes of NCDs, and they were all lifestyle factors. So they were tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diet in that order. And I went, well, this cannot be true. Like, it cannot be four major lifestyle factors that influence NCD risks. There should be, other bigger, greater external factors that act as stressors, therefore cause or heighten NCD risks. So as an epidemiologist, I was thinking it's okay, it can be all about confounding, all about upstream factors. So in addition to four factors that WHO mentioned as four major causes of NCD, I was thinking, oh, there could be environmental factors, economic factors, or things that are not under individuals' control. So again, underlying assumption was that physical inactivity, as a physical activity researcher, I thought physical inactivity may be as much of an outcome of broader structural factors than within individual volitional control. So in this equation, I added CO2 emissions and neoliberal ideology to really clarify the association and the major causes of NCD risks. And to be specific, so I added physical inactivity and CO2 emissions as a potential effect modifier. I thought that these will modify the association between neoliberal capitalist ideology and NCD risks. So my hypothesis was that more neoliberal countries, they will show higher NCD risks, but physical inactivity or CO2 emissions may moderate this association independent of tobacco use, alcohol use, overweight, obesity, and GDP per capita. So as a result, I found that neoliberalism was associated with increased NCD mortality. So hypothesis one was proven to be true, but also there was a paradox. So this association was the strongest in low emission countries, whereas the association between neoliberalism and NCD mortality was the weakest in high emission countries. So there was that global inequity in terms of climate culpability. So implications from this work were that political economic systems drive climate-related health inequalities, and physical inactivity may not be a cause of NCD mortality at the end. So based on this research, my conclusion was that, okay, health outcomes reflect global systems, not just individual habits. Climate culpability linked to patterns of consumption and inequity. So therefore, reimagining responsibility is central to planetary health ethics. So here, what I say reimagining is setting physical activity not as a lifestyle risk, but as a structural responsibility. So following this work, what I've done is to clarify the relationship between climate change, movement, and health. So I conducted two different types of reviews. The first one on the left, it was umbrella review, looking at the associations between climate change, 24-hour movement, behaviors, and health. And the second one on the right side, it was a systematic review. So it has more focused topic, more specific eligibility criteria based on original studies. And based on those two reviews, basically what they've suggested is that physical activity can act as a mediator or moderator of the association between climate change and health outcomes. So specifically, 35% of evidence suggested that physical activity mediates the climate health relationships. So it explains why that relationship exists. And 28% of evidence suggested that physical activity may moderate, so it may buffer the negative impact of climate change on health outcomes. So we found that evidence for physical activity but for sedentary and sleep pathways, there was not much evidence to make concrete conclusions. And also in physical activity, I was also interested in outdoor play because it happens outdoors, and play is a fundamental lifelong human behavior that supports development, healthy growth, well-being, learning, creativity, social connection, and the right to meaningful and inclusive play experiences across the lifespan. So now, for this review, I focused on looking at the association between climate change factors and active outdoor play. And based on the result, so this figure presents an evidence map of the association between ambient environmental conditions and active outdoor play. And if you look at the bottom of the figure, so meteorological conditions, um, in general, it showed mixed evidence with a tendency towards negative or null association, particularly under extreme weather conditions. And in the second box, atmospheric exposure, such as ultraviolet radiation exposure and poor air quality, they were associated with lower levels of active outdoor play. So environmental conditions impacting active outdoor play. And at the top, land use and environmental features show the predominantly positive associations. So features like green space and shade supported active outdoor play, whereas urbanization and pollution-related factors were generally acted as a barrier. And this result is based on qualitative synthesis. So in addition to looking at, okay, what kind of impact climate change has on active outdoor play, but we also examined, okay, what kind of role active outdoor play has in the face of climate change. So I want you to focus on the resilience and adaptation part of the circle. So if you look at resilience, there's community-led initiatives, education and awareness that embedded active outdoor play as part of its component, and building active outdoor play infrastructure, so building green space, um, and cleaning up the blue space. It all impacted building resilience of a community and nature-based solutions as well. In terms of adaptations, it was focusing on how individuals react to climate change and adapt to climate change to continue engage in outdoor activities that they like. So the things that they have done was to wear appropriate clothing, equipment, embodying climate change, embodying changing climate, modifying their environment, strengthening parental and institutional support, and reforming policy and urban design, and also time-based scheduling. So they negotiated their schedules to be able to go outside. So, for example, when the extreme heat is not so intense, so at dawn or in the early in the morning, they will go out to play. So this type of research and this result really gave me a hope, and lots of people in the face of climate change, we are discouraged, we are disempowered. But I thought, okay, there can be a thing that we can do with the activities that we already do in the face of climate change, just to be more hopeful, just to be more positive about what's happening. So. I position physical activity as part of the solution in my research. So combining physical activity promotion with upstream interventions like reducing air pollution, increasing green space, blue space, and enhancing social cohesion and social connectedness could amplify its benefits and contribute to climate adaptation and resilience. But still, knowledge gaps exist. There's insufficient evidence with mixed findings, lack of longitudinal global intersectional studies, underrepresentation of low and middle income regions, limited integration of behavioral and climate data systems. And representation is really important in my research because understanding movement in context means collecting data that reflect lived realities across regions and identities. So not having sufficient evidence makes it difficult to translate knowledge into policy and practice. But the hope and empowerment, proactiveness components makes me it triggered me to do some advocacy work for the past years. And with climate change, change is happening in a more rapid pace. So taking immediate action is really important. So some of the advocacy work that I've done, so in evaluating Canadian children and adolescents physical activity, so we look at not just the surveillance monitoring of individual behaviors, but we look at the systems and see how supportive the system is for children's activity levels. So for 2024 report, we integrated climate change component and resilience component. So what can we do to promote physical activity among children while also building their climate resilience? So this work was done in 2024, made a global impact. So report card project is actually as part of the global project that involve more than 70 countries now. And in 2026, we'll produce report cards from 76 countries, I think 76. So the impact will be there, and we are trying to develop new benchmark where we can evaluate climate change impact on different behaviors. Next work for policy and practice that I've done recently is to develop a position statement on active outdoor play. And in this position statement, we involved an 11-person leadership group, and I was part of that, with 143-person steering committee with representation from every inhabited continent across 32 countries. And we involved more global scholars for the last round of consensus of position statements. So this was a truly global initiative, collaborative work. And in this work, climate change was one of the components that we highlighted. So for climate action, we found that active outdoor play supports planetary health, aligning with Sustainable Development Goals 3, 11, and 13. So that's health and well-being, sustainable communities and cities, and climate action. And we also believe that outdoor play is a micro-scale climate strategy, fostering resilience, connection, and well-being through movement. And also it potentially aligns with other sustainable development goals that we were not able to find any evidence, but potentially life below water, that's SDG 14, and life on land, that's SDG number 15. And another work that I've done, actually, this paper just got accepted for publication yesterday. And this was really kind of experimental, exploratory initiative where we involved experts in animal health, environmental health, and human health. And we wanted to create a framework where we link One Health and active outdoor play. So the Play Plus Play Land Animals U and Plus framework expands One Health to include human movement and relational well-being. And for this framework, outdoor play is situated as a low carbon health promotion and equity-based behavior. And we know that active outdoor play promotes connection between humans, land, and non-human life. So we developed this framework based on consensus across 16 experts in different fields. We also developed this infographic based on the evidence from 2025 position statement and my One Health paper. So basically, it highlights the link between One Health and active outdoor play. And this infographic is for the general public. So engaging in active outdoor play nurtures a deepened connection with the natural world. And we found that there's an association between active outdoor play and environmental stewardship and also connection to nature. So based on that evidence, we came up with this statement. And also this connection can build a foundation for climate resilience and sustainable living. So conducive to planetary health. And the next work related to policy that I do within Canada is to join the effort to improve air quality health index. So by collaborating with Health Canada Environmental Bureau, we try to improve the messages that we deliver to the general public through this index. So right now it's only numbers and the risks. So 7, 8, 9, 10 indicates and the color scheme. So it indicates that it's a high risk to go out because air quality is poor. But these are the only two aspects that we currently communicate with the general public in terms of air quality health. So what we're trying to do is by investigating the association between social behavioral changes triggered by, and in the syndemic context, so COVID-19 and climate change. So how these syndemic triggered social and behavioral changes and how that influence exposure to air pollution. So behavioral and social determinants of exposure, particularly within the syndemic context. So question is, do these determinants increase or decrease air pollution exposure? And integrating behavioral and social determinants into their design and communication strategies will strengthen our kind of public health policy and practice in terms of relaying the message to the public in an understandable manner. And also tailoring alerts based on contextual features like urban green needs, traffic intensity, and time of day, as well as population vulnerabilities. So, for example, older adults, pregnant women, children, racialized or low-income groups can ensure that public health guidance is both targeted and also inclusive. So that's what we are trying to do. We've done some research in the past year, and now we are moving on to developing those messages based on the evidence that we generated. And another work that I do is actually inspired by my visit to NIC. So every time I go to NIC parks, they're so like people are everywhere. They're so active. They're chatting, and it's intergenerational. There are children running around. There are older people playing table tennis, and young people chatting, sitting on a bench, having fun. So I was really inspired by parks in NYC. So that made me to develop this project, and this project is funded luckily. So what I'm going to do, and I already collected some data from mega cities. So I'll just read this code. If kids are out there riding their bikes or walking, they're not burning fossil fuel, they're nobody's captive audience, they're not making any money for anybody. So you know that this is based on so my inspiration by visiting NIC parks, but at the same time outdoor play is declining in general worldwide. We used to play outdoors all the time, but now children nowadays they spend more time in front of a screen indoors because they think it's safer, or parents think it's safer to be indoors. And sometimes it's true, indoor can provide a shelter that we need, but outdoor play in green space can be beneficial for health and well-being, and for children, for growth and development. For older adults, it can be beneficial for community belonging and social connectedness. So this research, basically, we're collecting data from megacities. So in NYC, Hanoi, Vietnam, Seoul, South Korea, Tokyo, and Hong Kong, reclaiming play means confronting broader systems. So urban planning, transportation, and environmental justice that shape where and how children move. So basically, what we are trying to do through this research is in the age of climate change, outdoor play must evolve, becoming safer, more inclusive, and climate resilient. And what we are trying to get at is cities should design play spaces that offer shade, biodiversity, and clean air while nurturing children's curiosity and connection to the natural world. So we are really focusing on that hope, resilience, and empowerment, and also improving mental health perspectives through this work. And another thing that I plan to do, unfortunately, I wasn't lucky to get funded for this work, but empowering global youth for climate resilience. So, across the world, young people are facing a dual crisis, the accelerating impacts of climate change and rising levels of mental distress. And it's also related to eco-anxiety or climate anxiety. But they are also among the most powerful agents of change. So this project aims to empower global youth to become leaders in climate resilience using physical activity not only as a tool for health promotion, but as a catalyst for hope, community, and collective action. And in this project, our approach integrates three pillars. So the first one is physical activity as a resilience pathway. And the second one is collaborative leadership. So through close national partnerships and capacity building, we engage youth from diverse cultural and socioeconomic contexts to co-develop local solutions and respond to climate and health challenges. And the third pillar is capacity building. So we invest in skills development, leadership, communication, data literacy, and project management to help the youth to translate ideas into action and evidence into advocacy work. So now we also have emerging questions that I was not able to answer, but I think it's important. So how can climate health researchers integrate behavioral data more effectively? what partnership can bridge environmental science and health promotion. So embedding movement metrics in planetary indices and also treating behavior change as structural enablement, not personal discipline. So how can we reframe behavior change as collective and systemic action, not just as a individual responsibility? So, moving for the planet, key takeaways for climate health researchers. Climate change is also a behavior and equity issue. It's not just about individual lifestyle factors that shape individual health. Movement behaviors mediate and buffer climate health risks. So there's a potential that physical activity can serve as a effective modifier for negative impact of climate change. Active outdoor play offers sustainable, inclusive co-benefits, and true resilience requires structural and systemic change, not the change at the individual level. So, to conclude my presentation, bridging behavioral and environmental science is essential to understanding and changing our collective movement for the planet. Thanks for listening. That's the end of my presentation. Thank you.
Thank you so much, Young. That this was amazing. And this, I may not have the knowledge of this, but could you explain neoliberalism? And my apologies if everyone else knows this.
No worries. So neoliberal ideology is the basically it's an economic model where they focus on market consumer-based and competition-based market-oriented economic model. So typically United States, Canada, South Korea, so all the developed countries, they're pretty neoliberal. They're capitalist countries, and so they but whereas low and middle income countries, they will be either state capitalism or less neoliberal.
Wonderful. Thank you. It's fascinating. Not something I'm as familiar with. Thank you.
Thank you.
I think Emily has a question. Dr. Sun.
Yes, thank you so much. Yun Young, that was amazing. And I want to get back to a couple questions I have specifically for you, but as one of the board members of Climate Health Society, I note there's two new people joining us, and I thought if you're comfortable, if you want to introduce yourself, if not, that's okay. I see Diane and Kelly. Are you guys comfortable telling us about yourselves and what drew you to this? And then we're going to come back to a series of questions for Yun Young.
Sounds good.
Who wants to go first? Kelly.
I can go. Hi, I'm Kelly, and I'm an occupational therapist. I live in Southeast Wisconsin. I've been actively, intentionally navigating climate change and environmental issues, kind of sidelining my professional role since for a very long time. And I've been a part of Occupational Therapists for Environmental Action and Healthy Climate Wisconsin here in the state of Wisconsin. I'm a health coach in addition to being an occupational therapist, and I've been kind of actively trying to forge ahead with some just ways of my own to try to help people understand the connection between personal health and planetary health, and that, we can only thrive as well as the environment around us is thriving. And that when we take personal steps to come alive and thrive and live our best life, including being more active, we actually can play a bigger role in impacting a thriving environment around us. So that's a little bit about me.
Yeah, for sure. Thank you.
Hi, everyone. I'm Diane Moss. I'm a water resources and environmental engineer, and I was drawn to this from attending a session at APHA. We work a lot in increasing climate resilience and adaptation in the built environment. So this was particularly interesting to me because we think a lot about how do we build resilience within communities? How do we make sure that any infrastructure changes we're making also, are compatible with behavioral changes that, sort of look at the whole picture. So very drawn to how we can use the climate and health discussion to inform the decisions that we make in the built environment, and also breaking down the silos between design professionals and health professionals to kind of like really take a more holistic look at the problem. So this was fantastic, relates directly to some projects that we're doing on like thermal. We're working on a project looking at how do we make more of a thermal comfort playground for kids? How do we talk about impacting youth as well as, other populations that may be more sensitive to heat in particular. And I'm in the New England area. I live in Massachusetts. We work throughout New England and the Northeast. So very glad to be here.
Awesome. Thank
So
you.
you guys, you both represent part of our major aspiration of this society, which is to do exactly what you just said, break down silos. I'm a physician. I've worked in healthcare, climate, and sustainability for probably 15 years. And I've mostly talked to the same people during that time. And the effort of Climate Health Society is to bring in everyone, like yourself, Diane, like yourself, Kelly. So we'd really love for you to join us and engage. We're building this out as we go. We want a very broad-based interdisciplinary community so that we can do exactly what you are doing, Diane, and we can learn from you. And move forward. That's my pitch about Climate Health Society. So please, we'd love to have you on board and engage to any degree that you can. This is a startup. So, and I just wanted to say to Yun Young, and then I'll turn it over to everybody else. I'm a physician. I'm boarded in something called lifestyle medicine. Lifestyle medicine looks at the 6 pillars of health, as is Shirley, and where a lot of us come to climate medicine through lifestyle medicine, because lifestyle medicine is climate medicine. And one of the key things that happens when you keep people healthy through physical activity, nutrition, sleep, restorative measures around stress, and avoiding risky substance is you avoid emissions. If people don't get sick, they emit less carbon. The healthcare sector is responsible for somewhere between 8.5 and 10% of greenhouse gas emissions here in the US and 5% globally. So we see physical activity as a decarbonization and carbon avoidance action. I just wanted to throw that in there. So that's another metric, emissions avoided by people staying healthy. I'm hoping one day, my dream is to make sure that that gets to be one of the metrics that we use and offsets that we talk about when we keep people healthy, and we can monetize that maybe. So, okay, back to Lisa and Shirley.
Dr. Alexander has a
question. Yes, I'll put my hand down. Young, thank you so much for this presentation. It really resonated with me, and I really appreciate the overview of your work on, a strategic plan and doing that. I think it's very important for younger people to see, this kind of progression. My own experience, and I would love, one thing I'm thinking as we, talk to people from the different areas that are interested in this, is I would love to see, we have a forum or groups area on the Climate Health Society website, and I'd love to see some active discussion there about this. One of the things I did was I did a walk from Canada to Key West, and that's how I kind of got into climate health space. And I left medicine and said, okay, I'm going to do something different. I'm a rehab doctor by training. And so I ended up walking most of the way, and I got to South Carolina, and I realized that the built environment was just so negative that there was no way I could even walk, because it was not safe. There was no ability to get food, etc. But along the whole way, there were so many challenges to even walk. We are so terrible in our built environment, and walking may not be the same thing as play, but in many ways it is. And my own personal strategy that I had to do to finish this, because I started in 2019 and finished in 2024 was I switched over actually to a recumbent bike. I had to stop because of COVID and stuff, and it's all a long story. But I ended up switching over to a recumbent bike and skipping the bottom of South Carolina and Georgia because it was really not negotiable. And then biking from northern Florida to Key West. And my I would love to collaborate with you and, figure out how we can do more. I mean, when I think of the outdoor play, I also think about one of the things we don't do is do cooling vests or heating vests. This is like such a potential solution to humans adapting outdoors. And the other thing I've noticed here, I now live in South Florida. I am appalled by the number of people I see with rhabdomyolysis. I've never seen many people with rhabdo in my life. And as a rehab doc, I've had maybe 10 in the past month that are coming through. And this is supposed to be like a more rare condition. So I think with this collaboration, you're starting at the beginning. What do the kids do? And then we continue this process through a lifetime. I think it's great. So maybe we could start a thread in terms of discussing this. It's kind of, to me, it's part of, I had an organization that Climate Health evolved by sustain our abilities. And it's kind of the same thing as we should be able to go outside. We should do the things, people did 20 years ago. So thank you so much. It's not really a question, but any thoughts you have about how we can move forward and work together is great, I think.
Yeah, for sure. So lots of the comments that I received from peer review of my work is that I don't involve enough disciplines from different people from different disciplines. And my One Health paper, they were saying that, oh, it's imbalanced, like there's only one animal health expert. But we tried to reach out, but we couldn't get anyone with the project timeline. And also, we don't have any physicians in our active outdoor play position statement. And that was, one of the major limitations that we had, or people from OT. We had some people from PT, but not from OT. So I think this will be a great, Climate Health Society will be a great platform for us to collaborate and think about how we can work together and build a sustainable future together. Yeah. So yeah, I cannot agree with you more, Markley and Emily.
I think it would be interesting, Young, if we could do something on the forum in the lifestyle space. My thing, along with many here, is food sustainability, specifically, dietary patterns in the, agriculture systems and all that sort of horrific involvement. So it's like up to a third greenhouse gas and other land. The land and water use is actually more alarming than anything, but that would be something. So to maybe get a forum going. There is a planetary health forum actually from ACLM, but it would be interesting to go from the other side, which is, on the climate side, then talk about solutions related to lifestyle medicine or lifestyle changes in general. So that slide you had about, dietary lifestyle changes in general and their contribution, I think it would be very interesting to see how people are working on this because in general, that's kind of a win-win situation and people are motivated by their health and, there's kind of a spotlight on that now. So I think that it may be very interesting. So let's talk about that offline, about maybe putting together a forum like Emily had suggested. I know Lisa and I also are involved in a lot of food sustainability projects as well. And let's see if we can get something going. That would be great.
Yeah, for sure.
I think another piece in terms of that is we might want to think about this. We're planning our first international hybrid meeting next year, which will probably end up being in Istanbul because we're making it adjacent to COP. So it would be in November of 2026. And I think this is a real important interdisciplinary area to speak about in terms of how we can do some of these things. And I think the other piece we could help with is getting more youth involved potentially, because that's probably one of your critiques. But I do see that, being a lot of benefit. The other point that comes up to me is solastalgia. And I really think about the mental health aspects about it. I mean, I realize that I have it as I see the built environment around us and how it's just so different. So I think that's something else to think about, the mental health aspect.
For sure.
Thank you so much. I really enjoyed your presentation. I'm getting ready to start a podcast called From Ache to Action, which is really capturing the stories of people who have transformed their planetary ache, their ache for the earth, into some type of action that's the antidote to their, it's sort of the healing, the medicine for their own ache, but it's also healing for the environment. And this presentation is sort of also anchoring in me this awareness, like, oh, duh, like it's action, like, it's taking steps, but it's also like physically being active. And my own journey really was rooted in when I first found out about the environmental crisis a long time ago. It was, I think, 1990 when I first read the report, the IPCC report. And in the late 90s, I rode my bike through South America, through Argentina, to talk to people about trash because I didn't know what else to do. And I was an occupational therapist at the time. And so I partnered with a physical therapist and we rode, he rode 12,000 miles. I rode 4,300 miles through Argentina to just communicate with people. And we were like, well, we're on bikes, we're talking about trash. So at least we're doing something and we're bringing awareness to this issue. And I think for me, I've done a lot of backtracking through my story to understand my own experiences of ache. And what was interesting is stepping into that, similar to what you were talking about. Is it Emily Alexander? Um, what was your first name?
Markley.
Markley.
Okay. Yeah, just like when we step into the action, we start seeing the problem more. And I think what I really try to help people do is I see so many people like, oh, I don't know what to do about climate change. I don't know what to do about the environment. So I'm not going to do anything and I'm not going to talk about it either because I don't know the science. I'm uncomfortable speaking about it. I don't want to look stupid or I'm afraid that the person sitting next to me doesn't care about this issue either. And I think when we step into action, we start solving the problem for ourselves, but we also start seeing the problem more, and there's more exposure to the problem, and then we lean into action more. So it kind of, so I guess with my podcast, that's really what I'm trying to capture. I would love to interview you at some point because your story is very compelling too.
Sure. Yeah, that sounds great. Yeah, and also by taking actions, so yeah, like lots of people, there's denial, climate denial, and also avoid talking about climate change because it's stressful. But also once they take actions, so what I'm trying to do is also among young people, I try to look at the mechanisms between climate efficacy, climate anxiety, and taking climate actions and how those can be linked to lead them to be more proactive about climate change solutions. So yeah, it's interesting.
This has been such a wonderful opportunity to listen to you and to also have such a rich discussion afterwards. And I think that really is what we had envisioned for this lecture series, that it's not just a one-way didactic, but it's really more of a dialogue. So this was truly lovely. And we will be recording it and posting it on the website. And just many thanks to you, Dr. Lee, and to everyone who was able to join this morning. Really do appreciate it.
Yeah, thanks so much for having me. This was a pleasure for me as well.